Sir, I think I would start by mentioning the constraints, the given situation as it existed when the virus first was cited or was detected, and the background under which we are facing this pandemic. First of all, we are facing this pandemic after 100 years. It's a once a 100-year situation. No one was prepared, no state government and even the central government, even the population, the entire country was not prepared. We did not have a legislation for a pandemic. We have an Epidemic Diseases Act, which was made 1897. We have a Disaster Management Act of 2005, with which only two legislations with which we were supposed to handle this crisis. The whole world was affected. No one was wiser. Absolutely no one was wiser. Even now, no one is wiser. Not even the medical fraternity. So every day is a learning experience, both in terms of containment, in what would be the vaccine strategy. So the strategy itself is dynamic. A system demands a dynamic strategy almost on a daily basis or on a weekly basis to address the situation. The speed and the spread, the R factor of the virus and the various variants of the virus is also not known. The kind of virus variants that are coming up in different parts of the world and how they travel, what is their contamination factor, that's also not known. No one knows everything. So to use hindsight to criticize is probably not the best strategy. It is most important to use hindsight to learn and improve. I remember we in this house, when we were discussing the statements made by the previous health minister, all of us clapped in glory, saying that we had handled the disease, we had handled the pandemic. The concern that was supposed to be raised for subsequent waves of the virus was not present in the entire house itself. To that extent, we must admit. Now, given why I mention this constraint is because all this points to the fact that we cannot politicize this handling of the pandemic. There cannot be no politicization of this pandemic because no one is wiser. The relationship between the center and the states, the cooperation between the center and the states is of paramount importance. Neither the center nor the state, even though health is a state subject, can handle the crisis. If it is left to the states, then the states cannot handle it, and even if it is left to the center cannot handle it. Even if both cooperate, then also they cannot handle it, because the most important is community, the people's participation, community's participation, and which was the most important strategy of our Honorable Chief Minister Amar Patnaik in Orissa, because of which we are where we are, with one of the least positivity rates in the country, least vaccination hesitancy, and least fatalities. Another point which is very important is that all parties have to cooperate. The next important point that we have to realize is global cooperation. Let us not forget that we got the vaccine in just about 10 months' time only because of global cooperation. Otherwise, the vaccines used to take about 3 to 4 years to come. And similar global cooperation is required to even get the vaccines. And therefore, the government of India and the government will have to participate and will have to persuade, which the Honorable Prime Minister did in the G7 by saying that the developed countries, the WHO has also said that we cannot have a country where they are vaccinating 12 to 18 or even 0 to 2 years or 2 to 4 years children, and there are countries in Africa which haven't even got the first dose of the vaccine. So global cooperation is required. Then another important thing that has emerged is the use of technology. Increasing use of technology is something that we have realized, whether it is in telemedicine, whether it is in education, in the other sectors that are affected by the vaccine. As far as the implementation is concerned, the most important thing that has come out is preparedness. We are prepared for the first wave. we were not prepared for the second wave. But in Orissa, let me just recount. We are the first state in India to enforce a lockdown in 40% of the state. That is, I'm talking about the first wave. It was the first state to dedicate government COVID hospitals run by professional hospitals. We divided COVID and non-COVID hospitals. There are a number of things that were taken as an early response to a pandemic. And this is what we have to learn for the second, or for the third, or the fourth, or the fifth wave. Let me remind the House that third wave may not be the last wave. Let me also remind the House that COVID-19 may not be the last virus. And therefore, I would like to say that the process should be to build redundancies in pandemic management. Just as in natural disasters, we have built in Orissa cyclone shelters, thousands in numbers after the 1999 super cyclone. They don't really serve any purpose when there is no cyclone. But whenever there is a cyclone, we are able to manage zero loss of life, zero casualty. Similarly, ICU beds, ventilators, COVID beds, we have to build that particular thing. Now next comes genome sequencing. Genome sequencing is something that will detect the variants very quickly. Now we have to ramp up our facility. Let me not quote the figures. We as a country probably had not been prepared for it. We have to have genome sequencing in every state, and maybe more numbers in single particular state. The most critical aspect, I am not going to repeat what my previous speakers have said, is vaccine production. In vaccine production, we have to increase supply. The number of suppliers are less, not just in India, all over the world. We have to improve the supply chains. We have to increase the number of manufacturers. We have to make sure that the TRIPS itself is automatically waived in an emergency situation. We should not have been countries begging to the world that please remove or waive the TRIPS. And also, accompanying waiver of the TRIPS, there should be transfer of knowledge, know-how. As far as the
make your last point.
I have 2 points. I have 2 minutes, sir. So now the most important thing, wherever we are currently, is that there are several unintended consequences like child marriages, abuses of women, economy, farmers, weavers, everybody has suffered. So the plan that we need to have is a consolidated, comprehensive pandemic management strategy. And this is the time to make it, and this is the House which should be contributing to making this particular strategy. Recently, Orissa's Chief Minister have made a suggestion that during the time of pandemics such as this, the SD, State Disaster Response Fund, where the states are asked to share 25%, should be reduced to about 10%, even better if it is not there. Another point is relating to one-size-fits-all strategies. One-size-fits-all strategies don't work. In Orissa, for example, when private hospitals are not available in several districts, there is no point having 25% allocated to private hospitals. Therefore, our Honorable Chief Minister has made a request to the central government, and during the last meeting with the Honorable Prime Minister, to change this quota to 95 and 5%. I think many other states could also be facing a similar kind of situation. There is also at this particular juncture, it is very important because there is a fear that the third wave or the subsequent waves could affect the age group of 12 to 18 years. We have to think about the vaccination. How to do it quickly. How to ramp up the vaccination and its distribution in such a manner that this particular age group is addressed. Therefore, our Honorable Chief Minister, Amar Patnaik, has made this suggestion to the Honorable Prime Minister during the last VC that the rollout strategy for 12 to 18 years should be thought of now. And a concerted, well laid out policy should be followed with required amount of delegation to the states to decide where to do it. When I say a required delegation of response to the states, I'm not saying that you completely assign it to the states. What I'm saying is that implementation is always better if you involve the community at that particular level.
Thank you, Dr. Patnaik. Your time is over. I have given you 1 minute more.
So just
please.
Half a minute.
Please conclude now.
So I would like to end by saying that we should not, we have suffered, the country has suffered in this pandemic. We should use this opportunity to be prepared much better whenever there is another pandemic. Let me remind you also that we have had Nipah, we have had Zika, we have had all kinds of viruses, maybe in localized regions in India, but it could have actually spread to the entire country. So let's be prepared. This is the time.
Thank you so much, sir. Thank you. Next speaker is...